This is Crystal Fenn from MedPage Today. I'm here at the American College of Rheumatology meeting. I'm speaking with Dr. Christopher Edwards from the University of Southampton about a study of myocardial infarction in rheumatoid arthritis patients. So, Dr. Edwards, in your study, what kind of risk factors appeared to account for the increased mortality and MI rates in patients?
Well, there was an increase in myocardial infarction rates which seemed to be determined both by the diagnosis of rheumatoid arthritis, that seemed to be the strongest driving force behind the increased risk, but also traditional risk factors had an effect, such as smoking and hypertension, hyperlipidemia. And there were also some effects from drugs that we would use to treat rheumatoid arthritis. And in particular, certainly from the initial look at the data, it suggested that prednisolone was associated with an increased incidence of myocardial infarction. Although, as we pursued the study and adjusted for various other confounders, that effect became non-significant.
So where does that leave clinicians? Should they be cautious about the risk with prednisolone?
I think they should. I think this work is a piece in a jigsaw puzzle of other studies which show that in general prednisolone use is associated with increased likelihood of having cardiovascular disease, and that's probably because the corticosteroids drive up blood pressure and worsen lipid profiles. I have to say that not all studies have shown this. Some studies, some recently published studies, have suggested if you get the diagnosis of prednisolone right and you don't use too much, then perhaps there's a beneficial effect on a reduction of myocardial infarction. So this is an evolving area at the moment.
Does the benefit outweigh the risk, though, for these agents?
I think that corticosteroids are a great treatment in rheumatoid arthritis if they're used in the correct doses. I think what this work shows is that if you're using excessive amounts of prednisolone for too long a period of time, then that would be a concern, because there is a good chance that by pushing up blood pressure and worsening lipid profiles, you could increase the likelihood of myocardial infarction occurring in a group of individuals who are already at increased risk of myocardial infarction.
Thank you, Dr. Edwards. I'm Crystal Fenn, MedPage Today.